All right, well, much the same agenda as we've had the last few meetings. Let's start off with Deb, updated on the public health section. Deb?
Thank you. Yes, thank you, Mr. Chairman. So we continue to stay steady at just the 14 positive cases. All 14 have recovered. We had 2,193 reports of negative tests, and we have 6 individuals that remain under quarantine. I did receive notification today from the State Health Department that they are moving forward with testing all residents of adult care facilities or assisted care facilities. We do have one in our county that would be the Falls home, and the State Health Department will be sending their team there tomorrow on June 12th to test the residents. So this is an initiative similar to the governor's initiative of a couple of weeks ago, where he wanted all nursing home residents to be tested no later than June 7th. So, probably take a good part of a week before we get the results of those back. The other thing that did change this week was that the staff at nursing homes are now required to be tested once a week rather than twice a week. So I'm sure that that will help to both the nursing homes and their staff to have that reduction in how frequently they had to be tested. I can also say that I know people are listening to the governor's press release, because soon after he finished, I started getting phone calls about pools, public pools, and when they can be open.
And somebody
was I on mute that whole time?
No.
No.
You were
Okay. I must have just accidentally hit it.
But can those who are not speaking mute themselves? We're getting a lot of feedback. You can unmute when you're ready to speak.
I don't have anything additional
right,
unless there are questions for me.
questions for Deb?
Deb, I have a question. This is Michael. So as far as the testing, the employees at the facilities are getting tested and essential workers, but how does that work in terms of businesses and that? Can they have their employees tested yet?
Well, I would say that if a business is now open, that they would be eligible for testing just as the essential workers were. I cannot speak to whether or not all insurances will cover it, depending on where an individual goes to get tested. So if somebody's looking to be tested, it's probably best to check with their insurance carrier to see if it's going to be covered. I would say that if a business is now open, that they would be eligible for testing just as the essential workers were. I cannot speak to whether or not all insurances will cover it, depending on where an individual goes to get tested. So
Somebody's listening to YouTube at the same time here.
I'm getting feedback. All right. Anything else, Deb?
no, I don't have anything additional.
Any other questions for Deb?
What I can add on the testing side, with respect to Michael's question, anyone that is now returning to work is considered essential from Schuyler Hospital's standpoint. I did confirm with them earlier in the week that they will continue to test anybody that is deemed essential, and if insurance does not cover it, they will absorb the cost.